Hi, I'm Jackie. In this video, I'm going to debrief you on the last two chapters, 9 and 10, from AI in Healthcare Organizations by Dr. Sean Humphreys, linked in the description below. Whether you work in healthcare, tech, or you're just AI curious, stick around. By the end, you'll know how translation tools and generative AI can make you work faster, safer, and more profitable. Chapter 9: AI as a Translator. Modern AI apps can turn speech or text into dozens of languages almost instantly. This matters in healthcare because clear communication cuts medical errors and boosts patient trust. Heads up though, if personal health information is involved, you must use a HIPAA approved tool. No casual screenshots in Google Translate. Some of the learning activities that we did in the chapter were testing a free translation app, interrogating ChatGPT about HIPAA and using translation apps, brainstorming safe use cases for an AI tool, deep dive research for HIPAA compliant services, writing a draft policy guide for translation services, and translating a brochure. One of the ways that this can be taken beyond the chapter is by using translated survey comments to spot new service lines. So, for example, sleep clinics can have ads in Spanish. Chapter 10: AI as a strategic partner. Generative AI is more than a writing robot. It can brainstorm markets, draft proposals, and even build simple prototypes. Some of the examples from the book that Dr. Humphreys completed were helping a small business recover a hacked social media page, and using AI to perform deep market analysis of what MBA students are saying about their struggles and needs. From that, he built clear recommendations and even prototypes to help the associate dean improve support for the MBA students. So, leaders don't just use AI to save time, they show others what's possible with it. Quick learning exercises. Ask AI to write a SWOT: strength, weaknesses, opportunities, and threats for a project that you care about. And run your own deep market analysis. I adapted the prompt given to us in Learning Activity 2 to CPAP patients, and I want to go ahead and show you that now. So I posted the exact prompt and I just changed CPAP patients here. Because in the book there was a copy and paste section where I could do that. So here's my deep market research analysis. And ChatGPT asked for a couple clarifications. But here's the CPAP patient sentiment on medical equipment providers, common pain points, things I've heard a lot. Billing and insurance headaches, frequent mistakes with supplies. Somebody got the wrong mask, they got the wrong machine. Lack of communication is a big one. Poor customer service attitude. I've heard people switch companies just because of customer service, and then excessive delays in getting equipment. So those are the pain points, things that they tried. Repeated calls, escalating to the manager, involving insurance and doctors, returning equipment, trying to switch providers. I don't know if you guys know that much about CPAP machines, but that's an area that I know a little bit about. And these are CPAP customers' dream outcomes. Some of these are real possibilities, in my opinion. I feel like some of these can happen. So that would be great, but not every company is able to do these things. So, hassle free automatic resupply, reliable service, a competent provider, uh, helpful and efficient customer support, having a knowledgeable and caring representative. I feel like this is something any company can do if they have someone involved in customer service. Any representative can be caring when it comes to customers in almost any company. I feel like that is definitely a real goal, something that can happen. So I wanted to show you my learning activity that I did here based off of that. So, ways that you can take AI further. If you have if you have a project that you're working on, and you can ask before you get it out into the world, you can ask AI, why might it fail? That way you catch blind spots early, and then the number of risks are fixed. So this is a good thing to ask AI. Because you don't just want to put projects out there and then be literally blindsided by something that you hadn't even considered. So asking why a project might fail would definitely help, and that might not be something that anyone is thinking about. So it can help save time that way too. And then another thing is building a rough mock-up in 24 hours. A benefit of this would be faster stakeholder approval, and you can measure this by how many days were saved just by asking AI to help build that. So you can measure return on investment just by checking the time saved. You can log the hours that AI shaved off of research or writing. And then if it's work related, you can multiply that by hourly pay and check that. So there's definitely ways to measure. For translation, you can see if there was new revenue. Did translations attract new patients? Were there any extra approved claims from having those extra patients or extra visits? So, chapters 9 and 10 show that generative AI can both be the Rosetta Stone and the trusted advisor of healthcare. If you found this helpful, try and experiment and measure the impact. See you next time.